Welcome everyone to Take Flight TV. I'd like to welcome Dr. Lisa Howell. She is a clinical health psychologist at Mayo Clinic Health System in La Crosse. Prior to joining Mayo Clinic La Crosse, she completed her postdoctoral fellowship at Mayo Clinic Rochester with a focus in health psychology, with emphasis in primary care psychology and psycho-oncology. She currently is helping patients with chronic health concerns and has special interest in the psychosocial impact of adverse health conditions, including diabetes, HIV/AIDS, cancer, and now in 2020, of course, COVID-19. Welcome, Lisa. Thank you for joining us today.
Thank you for having me. I'm honored to be here.
Appreciate your time. But Lisa, I was wondering if you could talk to us about what some of the signs and symptoms are that students can see in themselves or in their friends to indicate that they might be struggling.
Yeah, absolutely. Again, thank you for having me. I'm happy to be here today. The first thing I want to say is that during this pandemic, to feel stressed is completely normal. Many of us are sort of struggling with the uncertainty of our health, our family's health, even school and sports right now. And so it's important to recognize that when you're not feeling quite like yourself right now, that that's completely normal. But there are some things to look for in families, friends, yourself, teammates, even coaches that might illustrate that things aren't quite okay or that things may be worse than we would expect. So those might be some things like irritability, snapping more than they typically would, sadness, fearfulness, crying, sleep problems, so staying up too late or sleeping too much, tension, fatigue. If you notice someone who's avoiding interactions or appears to be more withdrawn, those might be some indicators that they're not quite like themselves and they might benefit from you reaching out, sending a text message, a Snapchat, just saying, hey, how are you? Are there things that we can do to help support you? How are you feeling?
Thank you. You know, if somebody notices those signs and symptoms, how important would it be to make sure that you're maintaining connections with that person, family, friends, and again, in our case, teammates, coaches?
Absolutely. Staying connected is a must, right? And I think the biggest thing with COVID-19, we want to follow the restrictions. So doing it virtually, keeping the 6 feet apart distance, wearing our masks when we're out in public, those are going to be key components of staying connected and staying safe while connected. But really wanting to reach out, connect to family, friends, and trusted support people is imperative during this time. Using virtual ways. I think what's tricky is we want to stay informed about the situation that's going on in our community, but not too informed. Um, so really trying to think about, if we wanted to be connected to information, we could be 24/7. So really thinking about if you're noticing, gosh, I can't get myself away from the news and that news might be making me more on edge, it might be worth thinking about, can I pick 2 times during the day that I want to check? And I'm going to check for maybe 15 or 20 minutes, not regularly throughout the day. So that might be something to think about. So connecting to trusted sources, trusted support people is going to be important, supporting them, asking how they are, but also sharing how you feel. And then also kind of limiting our interactions with the information we're getting from all the news sources about COVID-19 right now as well.
Lisa, what are some tips for students to manage when they are feeling a mental health impact because
Absolutely.
of the pandemic?
Absolutely. I think, that this is a tricky thing and it can vary from person to person, but some good general tips and tricks to manage stress during this time is to make sure you're getting enough sleep and good sleep, right? Be physically active when you're able to be, take advantage of the beautiful weather that we're having. Eating well, so trying to avoid too much junk food or fast food, but making sure you're getting balanced meals. Staying well hydrated, so making sure you're drinking enough water throughout the day. Um, Getting up and getting dressed and showered um, every day. I know it's easy to sort of get trapped into the jammy day every day lifestyle, especially when we're all working from home and living at home, but really prioritizing getting up and getting dressed. Engaging in meaningful activities, whether it's virtually or in your homes. Keeping up with chores, so keeping your place picked up can be helpful too. Practicing kindness, being gentle and kind with other people, knowing that this is hard for all of us. So if we can sort of have a mindset of kindness, that can be useful. And just being aware of our thinking. So if you notice yourself, gosh, I'm having more of those catastrophic kinds of thoughts, that might be something to look at for yourself too and say, gosh, how do I know things aren't going to get better? How do I know, it's going to stay like this? And really getting good at sort of challenging those automatic thoughts might be useful too.
Lisa, is there anything else that you want to share with us today? I think we could talk about this for a long time, and I'd love to
Absolutely.
have
Yeah.
you back and talk some more about it. But any last insights for us today?
I think the main things to remember is that you've gone through stressful times before, and we can use this experience to help us get through this too. Um, Eventually, things will move from uncertain to more certain. There's going to be hope on the horizon. If appropriate, try to avoid making big decisions at this time. If you need to, talk to trusted advisors, families, and friends. Keep track of your stress level. And if you need help and support, reach out to those of us in the community that can provide support, whether it's on campus, your local primary care provider, or more other local resources at home.
Thank you, Lisa, so much. Great advice, great tips for us. And thank you again for joining us today.
Absolutely. Thank you.